Knock, knock, knock. Hi, my name is Lisa. I'm going to be your student nurse today. I'm going to go ahead and provide privacy, do hand hygiene. Can you tell me your name and date of birth?
Cassandra Phillips, 120303.
Perfect. Can I verify your wristband? Thank you. I have an order to do a physical assessment. Is it okay if I do that today?
Yeah.
Okay. Can you tell me where you are? Okay. Can you tell me the month and the year?
October 2025.
And can you tell me why you're here?
Chest pain.
Chest pain. Okay. You're oriented times 4. My patient appears well groomed, no foul odor. Oriented times 4. Is it okay if I do a head assessment?
Yes.
I'm going to just feel, is that okay?
Yes.
Okay. I'm not noticing any alopecia, no abrasions, lesions, head is symmetrical. Have you had any head trauma or face trauma? No? Okay. I am just going to go ahead and look at my patient's face and neck. Skin on face and neck is appropriate. There's slight discoloration on the neck. Patient has a freckle on the right side.
Yeah, we have to do an aspiration.
I'm going to go ahead and look at our ears. Oracle of right ear aligns with right eye. No discoloration or fluid. Going to look at the left ear. Oracle of left ear aligns with the left eye. No discoloration. Skin is equal to color on face. I'm going to test your hearing now. I'm going to say color and you can just repeat it.
Okay. Black. White.
Perfect. Do you have any hearing loss or problems hearing? I'm going to go ahead and perform a test now. It's called PERLA. It's going to test the pupil equalness, the pupil roundness, how they react to light, and how they accommodate. So before I do that, I'm going to see what size your pupils are. They're supposed to be within 3 to 7. Both are about a 5. Have you had any changes in your vision? So I'm going to shine to see if your pupils constrict both directly and consensually. Both pupils constrict directly and consensually. So I'm going to look at I'm going to test your ability to accommodate first. So if you'll just look straight ahead. Both pupils do accommodate. So now I'm going to look at your nose. Your nose is symmetrical on your face. We're going to test your nasal patency. Perfect. Any congestion? Change in smell? No? Okay. I'm going to look at your lips. Your lips are appropriate color. Any change of taste or anything? Okay, I'm going to have you smile. Face rises symmetrically when patient smiles. Going to look at your teeth for dentation. Teeth are white, no discoloration, no odor. Can you say ah? Oral mucosa is pink, moist. Now I'm going to look at your throat. Can you swallow for me? Trachea is midline. Did you say if you have any problems swallowing? Okay. So now I'm going to have you look to the left, right, and now look to the left. Okay. Neck mobility is fine, appropriate. So now I'm going to check for respiratory. I'm going to just tell you about incentive spirometry. And in the hospital, that's a little machine we use to keep your airways clean. You'll use that 10 times an hour while you're awake during the day. When you breathe in, you want to breathe in and hold your breath for at least 5 seconds and then exhale slowly. And that's just a good way to keep your secretions clear. You also want to turn, cough, and deep breathe. That's also a good way of clearing your airway. Let's see. I'm going to go ahead and check your respiratory. Do you have any shortness of breath today? Okay. I'll go ahead and check for clubbing too. No clubbing on fingers. Nails are appropriate in color, rounded. Slight discoloration, it seems from dye or paint. Nails are symmetrical. Okay, no clubbing present. I'm gonna go ahead and check for temperature. And I'll check for edema too on the upper. No edema. Temperature is appropriate. Now I'm going to go ahead and listen.
Would be the second intercostal on the right. Make the second intercostal.
This is also where I would do bare skin if appropriate.
On the left side, just the what's the
Right upper lobe, I'm gonna have you just breathe regular. If you feel any kind of dizziness or pain, let me know. Okay.
Mitral. That's fourth intercostal. Yeah, that's tricuspid. And then you listen to the apical pulse for 60 seconds, minute, and then the accent.
All lobes are clear. Clear. Eupnea. Rate is patient's unlabored breathing. I'm going to listen to you posteriorly. And I'll have you take deep breaths this time. If you feel any dizziness, lightheadedness, please let me know. Forgot the respiratory. Hold on, no. I'm not sure that'll count because I went behind. So I think I'm gonna have to restart it. Let me just have you rotate and I'll be posteriorly in front of the camera.
Do you want me to hear?
Okay. So posterior lobe, I'm going to go right upper lobe. Deep breathe for me. If you feel any pain, let me know. All lobes are clear. Right lower lobe. Left lower lobe. Lobes are clear. Eupnea. Rate is 12 breaths per minute. That's normal. That's appropriate within normal range. So now I am going to do your cardiac assessment. You said you're having chest pain.
Yeah.
How would you rate that pain?
5.
When did it start?
Last week.
Anything you can do that helps with the pain?
Medication Advil.
Okay. What does it feel like?
Just sharp stabbing pain.
Okay. All right. I'll definitely get that documented. So I'm going to check for edema on your lower limb. No edema present. I would also go to the patient's feet. No edema. Check for skin turgor. Skin returns back within 2 seconds. I'm going to check your capillary refill. And it returns within 2 seconds. And the temperature of lower limbs is appropriate. So now I'm going to listen. I would recline my patient at a 30 to 45 degree angle. I'm going to have you look to the left. I'm going to check for jugular vein distension. No, to the right. No jugular vein distension on either side. So now I'm going to listen with my diaphragm. I'm going to start in the second intercostal space on the right side. And this is listening for the aortic valve. 2 plus regular. And now I'm going to go to the left. 2 plus regular for the pulmonic valve. Now I'm going to go down to the third intercostal space. Sorry. And fourth intercostal space. And this is the third was Erb's point, the fourth is the tricuspid, and fifth is the mitral valve, and this is where also the apical pulse is, and this is where I would take the pulse rate for 1 minute. And now I will listen with my bell for any murmurs. I'm going to start in the second intercostal space on the right side, listening to the aortic valve. And now I'm going to move directly over to the pulmonic. And now I'm going to go to the third intercostal space, which is Erb's point. Fourth intercostal space, and this is the tricuspid. And fifth, which is the mitral valve and the apical pulse, and you would also take for 1 minute. Both S1 and S2 sounds are present. All pulses were 2 plus regular. I'm going to go ahead and auscultate for your abdominal aorta to make sure I do not hear any whooshing. So this is where I go to the upper quadrant. No whooshing present.
Try like that.
No wishing present. Looking at the abdomen skin, there's no discoloration. Abdominal abdomen is flat. Go ahead and auscultate in all quadrants. So I'll start in the right lower lobe. I'm supposed to hear sounds within every 5 to 15 seconds. Sounds are within 5 to 15 seconds, which is within normal limits. Now I will lightly palpate. Any pain or anything? Alright. When was the last time you had a bowel movement? Okay. Any pain? Okay. How is your urination? Any pain when you urinate? What color is your urine? Any cloudiness or anything? Okay. When was your last menstrual cycle? Okay. I will feel your peripheral pulses. I will carotid. 2 plus regular. 2 plus regular. I'm going to fill your axillary. 2 plus regular. 2 plus regular. And now I'm going to fill your brachial artery. 2 plus regular. 2 plus regular. Now I'm going to fill your radial pulse. 2 plus regular on the right. 2 plus regular on your left, and now I'm going to fill your femoral. Are you on any heart medication? 2 plus regular. Now I'm going to fill for your 2 plus regular. And now I'm going to fill your popliteal artery. You're right. It is 2 plus regular. And I'm going to fill for your left popliteal artery. 2 plus regular. Is it okay if I fill your feet? I'm going to fill the dorsalis pedis. 2 plus regular bilaterally. And now I'm going to fill the posterior tibial. 2 plus regular bilaterally. And so now we are going to, I'm going to check your range of motion. Do you have any problem ambulating? Okay. Which is walking or being active. Are you active? Okay, so I just want to tell you a few things about being active and preventing pressure injuries. One would be being active like you're already doing. When you're active, you want to make sure that you're getting the moisture off your body in a timely manner. That can also encourage skin breakdown, so you want to get that off as quick as possible. And you want to make sure that you have adequate nutrition, so high protein. That prevents pressure injuries. And for your range of motion, I'm going to have you flex and extend. Okay? And now I'm going to do with resistance. And now with resistance. Perfect. And does that feel okay? Okay. And so now we're going to extend, flex. Perfect. And now you can do with resistance. Perfect.
There's the bed right here.
Perfect. Okay. So now I'm going to have you extend your leg, flex your leg. And we'll do with resistance. So, and extend. Extend. Perfect. And so now we're going to extend, flex you, flex. Okay, extend. Flex. Perfect. Does that feel okay?
Yes.
And now we're going to plantar flex, dorsiflex. Okay. So, and point your toes, flex your feet. Point your toes, flex your feet. Does that feel okay? Okay. So now we're going to do a Romberg test. It's where we're just going to stand with our eyes closed, hands to our side.
That's okay, as long as you just like remember.
Perfect.
Like you don't have to grade as you go.
Patient's
Like,
not
I know.
wobbling or anything. And now we're going to do heel to toe walk. Just a few steps looking straight out. We're going to test your gait. Perfect. Perfect. So now for the Glasgow Coma Scale, that's just to check for traumatic brain injuries to see how conscious you are. It's on a scale of 3 to 15, 3 being the worst, 15 being the best. You have had appropriate eye movement, eye opening, eye closing. You've had appropriate motor response. You've had appropriate motor ability, motor recall. So that's going to score you around 15. I don't see any risk for traumatic brain injury. Do you have any questions? No? Okay. Let me look at this. Thank you. Fantastic.
I'm just gonna check the color. Why did you get that close? I feel really invaded. We're gonna restart that one. This one's already. You really got it close first.
I took it too serious.
It's okay. It's okay. We're just gonna restart it. I got it now. Ready? Come in. Hi, my name's Sarah. I'm gonna be your student nurse for
Okay,
today.
I think that's going to conclude our assessment. Thank you so much.
Thank you.
I'm gonna check your
Whew.